I need everyone to understand that this is life or death. This really is not about anything other than the need to be compassionate about people in the state I was in. It's about those who no longer have the capacity to make safe, conscious decisions for their own well-being and safety. To put this in perspective, my wife and I are raising our 6-year-old niece because my sister-in-law could not decide to heal on her own. We have had this little angel for almost her entire life, since she was 3 months old. She calls her mom, Mummy Amy up in heaven. Let that sink in. It's time to take some serious action to help provide the opportunity to stabilize people and provide support until they're able to make those coherent decisions to heal and to be the people our loved ones have the potential to be.
As everyone here today knows all too well, Canada has been in an addiction crisis for several years. No community has escaped the impact. In our downtown cores, there are visible effects on every street, with individuals who have lost the ability to make healthy decisions, actively putting their lives at risk and causing fear and harm in the broader community. And more, Alberta's rural communities are seeing the effects of addiction. This is the challenge facing our country and our communities because of policies that tolerate and even facilitate addiction. We are continuing our work to develop compassionate intervention legislation, and we hope to be able to introduce it very soon. This would be a tool to help individuals who've lost the capacity to help themselves and are a danger to themselves or others. And if passed, Budget 2025 will provide $180 million over 3 years towards building 2 new compassionate intervention centres, one in Edmonton and one in Calgary, to lay the groundwork for the implementation of the Compassionate Intervention Act. These facilities, known as the Northern Alberta and Southern Alberta Compassionate Intervention Centres, would have 150 secure beds each and provide proper health care for patients with complex addiction or mental health needs, much more comprehensive than a traditional addiction treatment centre. I've also directed the Minister to identify up to 50 beds in Southern Alberta and up to 50 beds in Northern Alberta within existing facilities so that we can implement the policy while facility construction is underway. I want you to know that our government is 100% committed to helping those struggling with addiction in their pursuit of recovery. This was a promise that we made to Albertans in 2023, and I am committed to ensuring our government delivers.